Okay, well, hello, Helena, my guest to tonight. It's actually evening. Um, at the President's Chat. I'm really excited to have you here. We've known each other for a while now. You've been active in Queensland Medical Women's Society. You've been on our committee. When we still had our raffles, you were amazing, getting all the prizes. We were all in awe always. And after that, you've done some amazing things going forward. You've actually been one of our speakers at our May dinner in 2021. This was because you went to the WHO in Geneva and we had the meeting about United Nations. You spoke for Australian Federation of Medical Women at the Council of Status of Women, which is also the United Nations, last year on women's access through to health through technology. Very important topic as well. You actually had a National Council of Women in Queensland bursary, which
hmm
you won as well. So many exciting things. But today, I would really like to talk to you about your Menzies scholarship that you actually won, and you went to Harvard, which is pretty amazing. And that's really an experience I would like to know, or I would like our members to know more about as well. And so, could you tell us a little bit how about the scholarship and your time in the USA?
Yeah, I was very lucky to study at Harvard Medical School, as you mentioned, doing a Master's of Global Health Delivery. And for that, I received funding as a Menzies Scholar, and then I also received additional funding through the American Australian Association as a Sir Keith Murdoch Scholar. The program was amazing. It was a really small cohort. We came from different countries all around the world. I think we came from like 16 or 17 different countries, and we were a mix of clinicians from surgical, pediatric, obstetric, general family medicine backgrounds, people who worked really high within hospitals, such as hospital executives or government officials, and then also some people who were involved in health leadership, such as from the nursing side of things. And we had like a social worker who's holding a leadership position in the health network. And as part of that, we really centered around the idea of global surgery and global health and how we can contribute to, from a systems perspective, how we can improve access for people from vulnerable or disadvantaged communities. This really stems from the teaching and sort of the pioneering work of Dr. Paul Farmer, who was our department chair until he passed away February 2022, unfortunately. And he was also the co-founder of Partners in Health, which is an excellent example of an organization who work really closely with hospitals and government officials to be able to set up structures and programs to be able to improve the access for those who are from vulnerable communities. And so that was sort of what our program was about. As part of that, we did a research thesis. And so my thesis was done with Boston Children's Hospital under the supervision of Dr. Michael Millis and Dr. Grant Hogue, who are both pediatric orthopedic surgeons, who are both, well-renowned surgeons and really amazing to work with. And my thesis was looking at how socio-demographic factors influence children with hip dysplasia in terms of having more severe symptoms associated with the hip dysplasia when they first present to a pediatric orthopedic tertiary setting. And so that led to some really interesting findings and sort of opened the door and was really the first study in the field of global surgery and pediatric orthopedics was this study
Okay.
that
Yeah.
formed the basis of my thesis.
Yeah. And what were some of those findings?
That unsurprisingly, people who come from lower socioeconomic status, those who come from races other than white, and those who don't come from English speaking backgrounds have more severe patient reported outcomes, so more severe hip function in terms of pain, limited mobility, or stiffness when they first present to orthopedic surgeons.
Okay. Wow. Yeah. So that probably will have an impact.
Yeah.
Yeah, yeah, knowing that. Okay. And what was it like living in Harvard?
It was amazing. I lived on campus. I lived actually on the business school, and so I was completely in the center of Harvard. And then I would catch the shuttle to the medical school, which is over near the Harvard Hospital campus in Longwood, and it was amazing. I got to do some really interesting subjects. I did medicine as an undergraduate, so I never had done any electives until
Mm.
this program at Harvard, and so the first time I ever got the opportunity to pick my own subjects was when I was studying at Harvard and had a amazing range of subjects available to me. So I did some in humanitarian medicine and sort of frontline work with this course was done through the United Nations. I did some on adaptive leadership with an incredible professor called Ronald Heifetz and Farai Chipungu, and I had the best time being able to explore the different 13 schools within Harvard. So School of Public Health, School, the Kennedy School, the Business School. I was able to take subjects at all of them. So it
Oh,
was great.
wow. Yeah,
Yeah.
yeah, yeah. And you probably met lots of interesting people as well.
Very interesting people. Yeah.
Yeah.
Yeah. I think you realize that you are the most boring person in all of your classes. Everyone has amazing backgrounds.
Well, if you consider yourself boring. Wow, okay, yeah. And so I guess it's not open for everyone to be able to do that. Um, if somebody who sees this interview would like to take a shot at it, what do you think they should do?
I think anyone can go. I think the having experienced a whole range of classes at Harvard from all the different schools is just the variety and diversity of the backgrounds of people who go there. And I
Hmm.
think that's I think that's why it's such an excellent academic institution is because there were so many times I was like floored with the perspectives that were brought up by other people where I feel like I have a pretty open mind and I really take the time to understand other people's point of view. And so I think because I have that sort of open mindset, I was still like, just people would come up with these ideas or perspectives or things that I had never even thought of. And I think that's the value of being able to study somewhere like this, where everyone, wants to go there and studies really hard to be able to go there, and then to be able to be in a room where everyone comes from such different backgrounds. So I think if someone is interested in applying to do some overseas studies, I would strongly recommend it, but I also wouldn't deter anyone from doing it because I think everyone has a really valuable perspective to be able to ask. Everyone has strengths. Everyone has a excellent reason to be there. So it can be, I think you need to prepare for it pretty far in advance in terms of from your first time thinking about the idea to then being able to hop on a plane and go there. It is a long period of time, and part of that is, funding. And if you apply for scholarships, you have to sort of be aware, just have your finger on the pulse about what types of funding is available. If you're interested in funding, what programs are available. Talk to people who have done programs that you might be interested in to be able to really understand, if you're going to do this, what the best course is for you.
Yeah, 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 yeah. And I can see how it would really make you more aware of your own cultural lens.
Absolutely.
Yeah,
Yeah.
yeah, where you think you might be very open-minded, but still,
Mm,
that's the time where you actually find out. Yeah, yeah.
mm.
I recognize that. I mean, I come from a country which is very similar to Australia, but once I arrived here, I actually noticed that there are some cultural differences, definitely. Yeah, yeah.
Absolutely.
Mm.
And
Well,
makes me appreciate the Australian healthcare system.
yes,
Yeah.
yes, yeah,
Once
I
you've
can
worked in it,
imagine.
once you've worked in a healthcare system that doesn't have universal access or something like Medicare. So,
Yeah, 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 definitely. What would be your biggest takeaway from that time?
ooh, that's really hard. I honestly think it was a life-changing experience. It's definitely been the best experience I've ever had, in terms of professionally, sort of personally, academically, was pushed harder than I'd ever been pushed in medical school. I think the biggest takeaway that I had was probably that I think the idea that if you if you want to do something to change the system that you're working in, the department that you're working in, um, it's or solve a really complex problem, it's really important that you are adopting an open mindset about the various perspectives of the stakeholders. And I think I go back to this lesson from a class that I did in adaptive leadership under Professor Heifetz, is that you can have a really complex problem in medicine, in whatever field you work in, and unless you can take a step back and you can try and diagnose that problem, and you spend time trying to understand all of the complex facets associated with that problem, that's when you're going to be able to come up with a solution. And that solution doesn't have to come from you as an individual or your idea. It can be a solution that comes organically from just engaging all of the stakeholders. And I think that was something I really reflected on in medicine, is we deal with complex problems all the time where we have patients where they have a complex diagnosis, or it's a diagnostic dilemma, and we as clinicians do this really well, where we take a second to pause and sort of take a step back and think, well, actually, like, what is the problem, and taking the time to define the problem to be able to determine the solutions. And I think that's very translatable into the broader healthcare system, or zooming out beyond just an individual patient.
Yeah, yeah. Well, and maybe also take into consideration the perspective of the patient and
Absolutely, yeah.
the system around the patient. Yeah,
Yeah,
yeah.
I think that's something that I learned so well in my coursework through the Harvard Medical School, is you can't decide what someone else's barriers is to receiving care without asking them and taking the time to sit down with them and establish rapport and ask open-ended questions about why they didn't come to that clinic, or why they don't want to have surgery. You can't just assume that they don't want to be compliant with their medication because it's a personality trait. You have to take the time to understand, well, actually, maybe it's a financial reason that they can't take their
Yeah,
medication.
yeah,
You're going to take the time to sort of dive into those questions to really be able to impact someone's life.
yeah, yeah, yeah. No, I couldn't agree more. It's very much taking into consideration all the different aspects and making
Mm,
that initial connection with the patient. If you don't have that, you can't really provide the best care. Yeah, I
mm.
agree completely. Yeah. Now you've had that experience. What would you like to do with it going forward?
Well, my dream is to be an orthopedic surgeon. So I'm working
Yeah.
as an orthopedic principal house officer now back in Brisbane, which is amazing. And it's really nice to be back in the clinical world. I still did clinical work when I was over in Boston, mainly at Boston Children's Hospital, but it's really nice to be back sort of in the role as a PHO. So I've applied for training, and hopefully will get onto training one of these years, be able to complete my training. And then afterwards, once I am fully qualified, I would really like to have some type of practice that's able to combine the non-clinical things that I learned and really valued at Harvard with the clinical side of things. And I genuinely really love treating patients. And so whether that's something that I'm involved in policy making, or having, holding a position within the hospital to be able to think about those, zoom out and think about those broader health questions, or if it's something to do with continuing my research in sociodemographic factors influencing different types of conditions in orthopedics or surgery more broadly. I'm not entirely sure what that sort of branch of my practice will look like, but it would be really amazing to be able to continue applying the knowledge and the lessons that I learn over there into the Australian healthcare system and in orthopedics.
Yeah, 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 yeah. Like you say, a life-changing experience which you can take with
Absolutely.
you going forward. Yeah, exactly. And well, this is not everything. I mean, we will also have your biography in the description of this clip, but you have also been named in the Forbes Asia 30 under 30 list, which is amazing. It really is. Congratulations with that.
Thank you.
Very, very exciting. Um, can you tell us a bit how that process goes? Do you know?
Yeah, well, I actually won a innovation challenge at Harvard. So every year Harvard runs something called the President's Innovation Challenge, and it's a year-long challenge that goes across the 13 different schools. I think they have like more than 1,000 applicants or something crazy, and you sort of get knocked out at various rounds. But I made it to the finals, and I ended up winning that challenge. And as part of that, I worked with a team to develop a device that helps manage symptoms associated with urinary incontinence. Um, and that was a really fantastic experience to have, about trying to, again, I think just developing a different muscle in terms of, as clinicians, we see problems all the time in work where you're like, oh, I wish I had X, or I wish there was a Y solution for this problem. And being able to think about what those solutions may be in a really practical, sort of tangible sense. And so through this challenge, like, iterated 5 different prototypes in how to deliver this type of therapy through a patch worn on a patient's ankle, which is what we ended up sort of settling with. And following that, I was the first Australian to ever win this challenge. And then following that, I got an email earlier this year saying I'd been nominated for Forbes 30 Under 30, and giving me a link to fill out some information about me, and asking some questions such as who my leadership role model is, or what I envisage my career to look like, things I'd done before, sort of asking for more information. And I thought, oh, well, that's nice to be nominated. And I didn't think anything more of it. I sort of put it to the back of my mind. And then I was actually sitting outside, I was sitting outside theatre in the hospital I work at the moment, and had a moment between cases. So I checked my email and got an email saying I'd made Forbes 30 Under 30. So it was a really nice, sort of out of the blue surprise to have
Yes.
months and months later, from filling out a random questionnaire.
Yeah, well, you didn't end up there just by accident. So that is really, really amazing, definitely.
Thank
Yeah,
you.
yeah. Well, and I can imagine you being a role model for many, many people. You just mentioned role model. Who is yours?
I have many role models. I have some excellent role models in orthopedics, people who I worked with as a medical student, who's still one of my biggest role models in terms of why I went into orthopedics, and he's been such a sort of steering, guiding person in my career so far. And I've got some other excellent role models in orthopedics. Um, Outside orthopedics, I have really enjoyed being able to see how clinicians have balanced um, a surgical workload with sort of tackling those big questions that I'm really curious in. And I think an excellent example of that is Dr. Catherine McDougall, who's our Chief Medical Officer, and is an amazing consultant in the orthopedic space. But I'm always so interested and curious about what she's doing outside orthopedics. And I think she's been such a fantastic role model in terms of giving me the bravery to go to Harvard and sort of take the time to explore those different questions, develop those different muscles, but also seeing how she's navigated a career where she's balanced both so well. And there's another example of a surgeon called Dr. Annette Holian, who's the immediate past, or sorry, not immediate, she was a previous AOA president. And she's someone who I met at the World Health Assembly in 2019 in Geneva, with the discussions around developing national surgical obstetric and anesthesia plans in developing countries. And she's another excellent role model to me about how someone's been able to utilize their clinical skills to think about systems-based approaches to improving surgical care. And then my last role model is always my mum. She's not anything remotely to do with medicine, but she's such an excellent example of someone who's been able to balance a very successful professional life, but also her first job has always been a mum, and she's so present, and been an excellent role model to my brother and I.
Wow. I think no mother could wish for more than have a daughter like that who sees her as her role model. No, definitely. And well, that is amazing. It really is. And I know you are a role model to many others. I hope you will be a part of our mentor mixers. I don't know if you can make the next one in July, but we will be organizing more. I think that would be wonderful to have
I
you
think
there.
I'm still someone who needs mentors, not to be.
Oh, well, I can tell you, the first mentor mixer we did, the first medical student I spoken to, she actually already gave me a tip on something that I didn't know. So it's an excellent example how mentoring goes both ways. There's always something you can learn from everyone. So
Definitely.
no, no, please come and be our mentor. That would be great. And we're really happy to have you back in Brisbane.
Oh, it's so nice being back.
Yeah, and back at the Queensland Medical Women's Society. And we hope to see you there more often as well.
Yeah.
I know it's really busy trying to combine it.
I
And like
love
you
the
said,
dinners. They're fantastic. They're always such interesting topics too.
yeah, okay, that's good. Yeah. Yeah, our next topic will be about fertility, which
Mm,
is always a big topic for our younger medical women.
mm,
And so that would be interesting too. And
mm.
thank you very much for being my guest today.
Oh,
I
thanks,
think,
Ira.
yeah, we're around the 20-minute mark. So I know there's a lot more to talk about, but we have to stop here. So thank you very much.